The agenda this week got advice on how to talk to pandemic skeptics, debated whether vaccine passports are divisive, and heard why American author Tom Nichols says the people may have become their own worst enemy in liberal democracies. The agenda's week in review begins finding out why optometrists in Ontario won't see children or seniors right now.
Vision is our most important sense, and regardless of whether or not we're in a pandemic, I think you have to consider that these are essential healthcare services, and they're services that need to be dealt with and managed. I think what we're seeing here, there's a history of 32 years of Ontario governments not taking action around primary eye care services, and I think that's where the real problem lies.
Let's do some of the math here, because I think people need to have a better understanding that if, for example, they are going to see you and the Ontario Health Insurance Plan reimburses you for part of the cost of the service that you are providing, let's do the math. What does it cost and what does OHIP actually reimburse you for?
So we have multiple data points that indicate that the cost to provide a comprehensive eye exam in the province on average is around $80, and OHIP on average is paying $45. That 45 number has only increased $5 since 1989, and at that time we were being paid $39.15. So if you take that $39.15 and inflate it over 3 decades, you're arriving at a number that's close to $80. And we've done studies. We look at other jurisdictions. There are 4 other provinces in Canada that provide publicly funded eye care services. And when you compare apples to apples on what is being provided, the next lowest reimbursed province is Manitoba at 77. Following them is Quebec at 106. And following Quebec is Alberta at 137. So we don't understand why all these other provinces have been able to figure out how to resource these important services, and the Ontario government can't.
So just so I understand, is this to say that every time you deal with a patient who needs to use the health insurance plan to see you, you're losing money?
Yes, we're paying to see those patients. That's correct.
How does that make sense?
It doesn't. That's why such a drastic action is being taken, because we want to, we have to break this logjam with the government. They need to understand from the public the importance of these services to people, and they need to resource them correctly. Optometrists in this province are offering to still work for free, so the optometrist isn't going to receive compensation. But if they're reimbursed at the $80 level, that's going to cover their costs like rent, staff salaries, insurances, equipment rental, utilities. That is what it costs to provide a 20-minute to half-hour service to patients in this province.
Do you think, in your judgment, the province of Ontario has made a fair offer to the optometrists?
Yes, I mean, as you pointed out, we've made a $39 million offer, which is a retroactive payment. And what we're trying to do is show good faith to the optometrists that it's a kind of a catch-up fee for 10 years, going back 10 years since they've had an agreement, which ended in 2011. And it gives them $39 million. They're going to see it on October 5th in their remittance advice, and it will flow on October 15th. And that's regardless of whether the OAO comes back to the mediation table or anything else, or whether we get an agreement. However, it is a sign of good faith, and we're hoping that the optometrists will respond in kind, in good faith, by continuing to provide what Dr. Salaba, in the interview you've just done, said are essential medical services for seniors and children, and also, show us their costs so that we can come to an agreement about what is an appropriate fee.
I talked math with him, so let me talk math with you. How did you arrive at the $39 million figure?
Well, it's basically going back and looking at the increases that physicians have had over the 10 years and doing the equivalent for optometrists. And so it's a catch-up kind of a fee. We've also offered to increase the OHIP fee immediately that they're being paid by 8.48%, which, given the constrained fiscal environment in which we're operating right now during a pandemic, is generous, I think, and is a good starting point for discussions. We're not saying that's the end of it, but we need to see evidence to go over in detail what their costs are. Remember that optometrists in Ontario provide OHIP insured and patient pay services like selling contact lenses and glasses and non-publicly insured services. And so their costs are kind of complex to calculate, right? They would be different depending on patient mix, the types of patients they get, their rent, how much technology they use. Any number of things would factor into, what their costs are and what their revenues are. And, we're having an increasingly digital healthcare system. It's really burgeoning with digital technologies. And that's also impacting how optometric services and other services, other health services are provided. So we need to go over all of this in great detail with them.
No, appreciate all that. But let's, again, going back to the math here, just see if you agree with his basic premise, which is that it costs them $80 to provide the service, and OHIP basically reimburses $45 of that. In other words, they're losing money every time they see those patients. Do you acknowledge that?
I hear you, Steve, but honestly, we don't know what it costs. That's what they've said, it costs. But we don't know what it costs, because that's why we have to get back to the table and do that work and look at all those services that they're providing and all of those things I just went through. We don't know what it costs. We can't just take their word for it. That wouldn't be fiscally responsible as stewards of taxpayer dollars. And frankly, they're being a bit disingenuous about the way they represent the coverage of eye care or vision care across the country. I mean, Manitoba may have a higher fee, but it pays it only once every other year, not covering every year as we do in Ontario. So there's a lot of other things to consider.
We're going to put up a bit of a checklist here, which you have discovered are, essentially the same kinds of things that you run into when you run into people who want to essentially deny the accuracy of the science as it relates to this pandemic. For example, there's a cherry picking of information that takes place, or a reliance on conspiracy theories, or a use of fake experts, or illogical reasoning, or a reliance on impossible standards for scientific reasoning. And as you look at this checklist, Lee, how are the things on this checklist playing out as it relates to the pandemic and COVID-19?
Every one of the 5 has been checked. And in the book, I go through for every instance, anti-vax, COVID, GMO denial, evolution denial, all of it. I go through and I check off all those 5 boxes. That rubric is something that other researchers discovered, some cognitive scientists before me. And that's really the blueprint for science denial reasoning. There are examples of this, of course, with COVID-19 denial or mask denial, vaccine denial, however you want to think of it. When you hear people saying that Fauci is lying, that he's in cahoots with the CDC, or that he's making money on it, well, that's a conspiracy theory. Or when people will talk about somebody that they know who seemed to get sick after they'd had the COVID vaccine, that's cherry picking. And I mean, even then, you could say that's also reliance on fake experts, because for all the claims that people are dying as a result of the vaccine, there was a fact-checking organization the other day quoted in Politico called the Poynter Institute, which found that there were 0 cases that had credible evidence of people dying as a result of the COVID vaccine.
Now, with COVID vaccines, people want to see with anything, they want to see the evidence. And with COVID-19, it's particularly difficult to actually see the evidence. And of course, the long-term consequences beyond that are going to be difficult to see in this very moment. In which case, how do you try to convince people to trust evidence, particularly if they can't see it themselves?
That's a really important question, because you've gone to the heart of the idea here that science denial is not about doubt, it's about distrust. And so the folks who are saying, well, this hasn't been proven in any long-term study, that's true. I mean, scientists recognize that. But here's the thing that you have to realize. You have to compare the relative risk. So what's the risk that there might be something that would come down the road, a year or two from now from the COVID vaccine, given an understanding of how vaccines work and their past history, not just this particular one. But also thinking about what is the likelihood that somebody who's unvaccinated might get COVID and face serious illness or even death. So there's such a thing as relative risk. Now, it is sometimes hard to get people to take that seriously. I had a back and forth with an anti-vax person by email that I was he claimed that there were 10,000 people that had died as a result of taking the COVID vaccine, which is just wrong. I mean, that number is just made up. And I asked him what his source was, and he told me it was an unreliable source. And then I said, look, even if you're correct, even if that outrageous number were true, it still might be a good idea to get the COVID vaccine, because look at how many people have died of this, around the world. And he came back memorably with the claim that, well, that was ridiculous because no one had died of the COVID had died of COVID anywhere in the world.
He thought nobody had died of COVID anywhere in the world.
In the world.
Correct. How do you have a conversation with somebody who believes that?
At that point, the conversation was over. I mean, there are some folks who are so far gone that there's really nothing that you can do. And I encourage people to understand that science denial exists on a spectrum. And the techniques that I'm talking about in the book can work on hardcore science deniers. There are case studies to show that they have worked. But they work best on people who are hearing scientific disinformation for the first time. So, get out there and speak to people who are the audience for science denial, the people who are confused, vaccine hesitant, if you want to think of it that way, before they go too far down that rabbit hole. Because here's the thing, if they begin to distrust for too long and they find community amongst the hardcore deniers, then they're going farther and farther down that rabbit hole, and it's harder and harder to reach them.
The vaccine passport system is now in place. It's been with us for a week. How do you think it's working out so far?
I mean, I think it's the right thing. We are now kind of taking this to the level they're at. And so for a lot of the people who are anti-vaxxer, it's an emotional response they're having. They have a lot of fear about things. And, to some extent, this is an emotional antidote to the sense where we're saying, okay, you have some fear, but you also have all these other things you would like to be doing. We're now going to ask you to choose between them. And it's kind of, I equate it to the father when you have the argument where the father says, that's it, argument's over. I have the car, I have the keys. If you ever want to drive my car again, you're going to play it my way. And that's what they're facing right now, is this tough decision of how much do they want to be an anti-vaxxer? How much do they want these freedoms that they're so used to?
Quam, based on what you're reading, seeing, and hearing, how do you think it's working so far?
Well, I'm very worried about it. I must admit, pre-pandemic, we had a two-tier society, and COVID made it worse. And I don't think divided societies ever work. And so I'm much more interested in thinking how we can get everybody on side for what needs to be a community effort to beat COVID. And I'm worried about policies which inadvertently divide us rather than bringing us together.
And Kavukian, how do you see it?
COVID vaccines and vaccine passports are indeed very divisive. There's no question. The issue is not whether the vaccine works. It certainly appears to work for 4 to 6 months, decreasing the probability of contracting COVID-19. But the question is, at what cost? And we also have to be respectful to both sides. I'm not an anti-vaxxer. I'm a classic liberal, but I want the sun to shine on the evidence on both sides, and let the photons disinfect the bullshit. I mean, we just need equal opportunity and hearing on both sides of the equation.
They do say sunshine is the best disinfectant. Okay, Carrie Bowman, what do you say about how things are going right now?
Well, look, Steve, it's clearly divisive. And, the question is, from an ethical point of view, is this division justified? And so much of ethics is tied to proportionality. We just don't know at this point whether it's truly justified. It's obviously having a social effect, and some of it is very negative. I also have my eye, and I'm sure we'll talk about this as our session progresses, but what are we left with when this eventually ends? In what way does it change our view of ethics? Because I find the discourse so far has been very, very black and white, sticks and carrots, no-brainer, slam dunk, all these metaphors. I see it as much more complex than that, and we've jumped in with both feet. I hope it's justified.
Well, Carrie, let me follow up with you on this, and you can tell us as an ethicist whether public opinion and where it's at, whether that should matter in this case. But the fact is, polls do show us that the vast majority of Ontarians support the vaccine passport idea. They support the notion that if you want to go to a Jays game or you want to go to a gym or a restaurant, other non-essential places, you should have to be able to show some kind of identification that indicates what your health status is. Are you on side with the notion that if 80% of the people believe that's the way we ought to do it, then that's the way we ought to do it?
Yeah, so that's a strong democratic principle. And look, that's a profound ethical argument. But I think most of us here and listening would appreciate that, majority is a terrible way to protect vulnerability and other people's rights. And so that's a great concern. Also, they're on board, but we have no metrics. What's the end point? What are the ins and outs epidemiologically? What will the effect be? It's so blended with other interventions, we may never know that. So although people, I would say, are on board, I appreciate that. I still worry about, how it affects many, many other people within our society.
All right, Quam, let me do the follow-up with you, which is, should public policy not favor those who are both in the majority, following health protocols, went and got their shots? Should public policy not favor them?
So I should start by saying that I am really very, very pro-vaccination. I do believe that when we look at the 4.5 million deaths from COVID worldwide and the actual incredibly low incidence of vaccine problems, that we're in the right place trying to get people vaccinated. And if anybody asked me whether I thought 18 months from the start of the pandemic, I'd actually be having a conversation about people's right not to protect themselves, I'd say this is crazy, it's ridiculous, right? And your right not to protect your neighbor, I'd say I didn't think we'd be having this conversation. And so I'm very pro that. The question for me is, how do you get there? And whether having and how you get there in a way that's that reduces consensus. And so, I believe that I am worried that if you go too quickly with vaccine passports, rather than do things that will bring other people along, that you can end up hardening opposition to vaccination. And for me, I think the vaccination is very, very important in order to protect us.
I tried to take a longer view of this over about 40 or 50 years and across countries. Remember, this attack on democracy is not unique to the United States. It's happening in Italy, it's happening in the UK, it's happening in Turkey, in Poland, in Hungary, in Brazil, in India. And I think that this is paradoxically because of peace and prosperity. Democracies can cope with almost any challenge except boredom. And in the book, I talk a bit about the prophetic voices that saw this coming. Christopher Lasch saw this coming when he talked about narcissism in 1979. But even further back, Eric Hoffer warned that in a book called The True Believer, that I think people need to start reading again as well, that when you have a middle class that's bored out of its mind, you are ripe for a mass movement because people have this need to feel some sort of meaning in their life, and so they want to go and invent great crusades. Part of that is to convince people, and part of the reason, Steve, I think that when you say this is not the message we've had over the past 5 years, we've developed a political culture in a lot of countries that is constantly premised on telling the voters that things are the worst they've ever been. These are the worst times ever. No one has ever suffered like you. No one has ever seen the kind of deprivations you're living in. And of course, this is nonsense. This is just, in most times in history, it's been nonsense. But certainly in the early 21st century, it's nonsense on stilts. But, you know, nobody runs for election by saying everyone's doing well, but we could do better. My opponent is a good person, but I think I can do a better job. You don't motivate people that way, and you certainly don't motivate them through social media that way. And so we've created a culture that says you are a victim. The world has screwed you over. Everything is terrible, and someone is to blame. And if you elect me, I'll hurt those other people, and I'll get even on your behalf. And again, you cannot sustain a democracy on that kind of behavior. You just can't.
Well, it doesn't, let me suggest it doesn't have to be all of one or all of the other in order for there to be a grain of pushback against what you're talking about. For example, it's also what you just said is an empirically provable fact that the times in which we live in many ways, have never been better for the most number of people. Having said that, globalization did shut down a lot of towns in Middle America, and there are drug problems as a result, and a lot of economic gains have been felt by the Jeff Bezoses of the world as opposed to more evenly felt across society. I mean, surely much of that is true, and much of that is a factor for the unrest in your country today, no?
There are two problems with that. First of all, as I point out in the book, having come from one of those towns, much of that deindustrial damage was actually done 30, 40, 50 years ago. And there's a point in the book where I'm talking to a friend from my hometown who points and he says, I remember when those factories were full. And I said, that's impossible. You can't possibly remember that, because when we were kids, those factories were already mostly empty. And so I talk a lot in the book about the lure of nostalgia. And so there's this assumption that, again, the data does not bear out, that somehow globalization in the past 10 years just emptied out all of these towns. The other problem with that thesis is the very poorest, at least in America, are not the people rebelling against democracy. As I say in the book, poverty, drug abuse, the undeniable impact of globalization, both good and bad, because I think the other problem is that we've decided globalization is just always bad, even though you and I are using it right now to have this discussion, we've come to somehow believe that all of this happened 10 minutes ago, but the people that are actually suffering from that are not the people that are attacking democracy. One of the things you find in the United States, as well as in Italy and the UK and other places, the most illiberal elements are middle-aged, middle-class people who are actually fairly well off. The people that attacked the US Capitol were not unemployed steelworkers. They were professional. They were accountants, dentists, real estate agents. Some of them chartered private flights to go there. This is what happens when you get a bored middle class that is fed a steady diet of propaganda about how they are the downtrodden and most aggrieved people in the world.
That's just some of what we covered this week on The Agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.